New development in a story the I-Team has been following for months. The proposed closure of a state-run hospital for kids with special needs in Canton. After our initial investigation, the governor put the closing plans on hold. But as WBZ's chief investigative reporter Cheryl Fiandaca shows us, staff and families are seeing some signs that the hospital's days may be numbered.
Angry former residents, nurses, and teachers took to the streets protesting what they say is the state's failure to keep its promise to pause the closing of Pappas Rehabilitation Hospital for children.
We're very upset. There's never been a pause. They continue to discharge patients to other facilities or to home. Now they're sending the younger children out. They're getting rid of every single patient.
Beautiful.
The state-run facility is home to severely disabled children and young adults. Staff say with all of the programs and specially designed therapies, the kids thrive, which makes the possibility of shutting it down devastating for the families who need it.
Would be like homeless to them, because especially with those kids who doesn't have a voice, it's not acceptable.
In January, Governor Healy decided to close Pappas to save money.
I think of it as a redirecting of services, of care.
But after a public outcry and an I-Team report, Healy reversed course and agreed to reconsider closing Pappas. But staff members say, despite what the governor said, it appears the state is still going ahead with the closing.
We haven't seen a long-term admission since before the closure was announced in January, and discharges continue at a very fast pace.
In a statement, the chief medical officer of Pappas told the I-Team, while the relocation and expansion of Pappas Rehabilitation Hospital for children into Western Massachusetts Hospital is paused, both facilities continue to operate, which includes admitting, discharging, and relocating patients when clinically appropriate. Keeping Pappas open has the backing of political leaders concerned that there's not a plan or a comparable facility where these kids would have a chance to grow and become independent.
I definitely feel the Department of Health wants to shut down Pappas.
We've had some great allies in the Senate and the House of Representatives that are very supportive of Pappas and recognize the amazing work that happens there. So we are looking forward to seeing the budget and hoping that there is some language in there to protect and fund Pappas.
The Department of Health says in 2025, Pappas did not admit any new long-term care patients, but did provide temporary respite care to more than a dozen whose caregivers needed a break. It also discharged 9 residents. Last month, the House and Senate included language in the proposed fiscal 26 budget to fully fund Pappas. Cheryl Fiandaca, WBZ News.